is a part of the plan of the Bush administration that essentially was a giveaway to the insurance companies. And they used that giveaway to charge the government up to 14% more for a so-called Medicare Advantage than for plans provided by the government. Why? Why should we go to the private sector, which is supposed to be more efficient, to pay more? So we are forcing those kinds of efficiencies on them, not on seniors. They will not be able to cut what seniors get in Medicare. In fact, seniors, like everybody else, are going to get a special bonus. And do understand, the seniors are the only Americans who have health care guaranteed to them. If you get old enough, you will go into the hospital at least, and you will be served. But we were not about to leave seniors out. We very much opposed the Bush administration prescription drug proposal, another giveaway to the companies, which left seniors with what is called a donut hole. Many seniors, in fact, need very expensive drugs, more so than the rest of us. And by the time that the senior got to a certain dollar amount of drugs, the government said, bye-bye. You are now in the donut hole. You will pick up the cost of this expensive medicine for the rest of the year. This was hugely unfair to seniors, and we are now going to close the donut hole, and this is how we're going to do it. Can't do it all at one time. That's going to be done over a period of years, but immediately there will be rebate checks of $250 to Medicare beneficiaries who have reached the donut hole. So they will have $250 to deposit right now, this year, in the donut hole to help pay for their drug coverage. First checks will be mailed out on June 15th. Again, just let me say my compliments to the Obama administration. It took us a long time to pass this thing. It hadn't taken them a second, because they were preparing all along, clearly, for how to implement this bill. Finally, just to give you some sense of what this bill does, I want to use my own district. All of us have been in this for healthcare, and everybody's been looking at what it does for her particular district. And there were people in caucus meetings who got up and talked about parts of the country where they lived in, or they talked about the hospitals, or they talked about disproportionate numbers of uninsured. We all had our special deals that we wanted to make sure we got into this. Let me tell you what I wanted to get into it. The District of Columbia has always believed that it is our obligation to provide the services that people must have. And so there are 50,000 plus Washingtonians who did not qualify for Medicaid, and out of our own pockets, without one red cent from the federal government, we, the taxpayers of the District of Columbia, have been paying for 50,000 people and going up. That's 50,000 people the last time I looked. No local jurisdiction can, on the tax dollars of the local tax base, pay for health care. Look what we're trying to do with the tax base of the United States of America. And yet the District of Columbia has done it. This included, by the way, undocumented aliens. And why? Not only as a matter of fairness, but because if that undocumented person, in fact, became ill, she will go, as she must, to Washington Hospital Center. If she is in an accident, you and I will pay to have her leg fixed. If she has a heart attack, we are not going to leave her out in front of the AFT by asking us to show her card first. So, if we are going to pay for it anyway, why not have her come in so that we can deal with her diabetes before we have to take off her leg or her foot or her toe. It will cost us less, and it is more humanitarian. So, both for humanitarian reasons and because it made dollars and cents sense, the taxpayers of the District of Columbia had been paying for 50,000 people. I said, let me tell you what, one thing you're going to do in this bill is you're going to pay for those 50,000 people so that poor and middle class and rich people alike in the District of Columbia are paying for them. And those people, almost all of them, not the undocumented aliens, and you know about what has happened there, but almost all of them will in fact be covered by Medicaid now. That means that DC taxpayers will pay something, but the federal government will pay the greater part because they will be covered by Medicaid. Look at my own district. 67,000 young adults are going to be covered right now on their parents' policy. 134 families who need tax credits, if they don't qualify for Medicaid. So they're going to need some tax credits. 134,000 are going to get affordable health care. 17,300 small businesses in the District of Columbia are going to qualify for very handsome tax credits. Yeah, we worked hard for this. There are some fools out there who talk about repealing this bill. Somebody reminded me that in the first election, according to the history books, apparently, after FDR was elected, that the Republicans ran on the notion, repeal Social Security. That was the beginning of their 40 years out of office. So anybody who wants to run to repeal health care, be my guest. But what you must do, what you must bear in mind is the kind of information that I have synopsized this morning is not available generally to the public. What is available is a lot of demagoguery about how we got to repeal this bill, it costs too much, and it won't do anything for you. There is going to come a moment in time, November 2010, where we will see who has the energy in this debate. We in the House of Representatives and in the Senate, in the first off election, when you are the party in power, are due to lose seats. Would it not be a great irony that if for the first time in 100 years, having given the American people health care, the payback to the House of Representatives, for example, were to be turning over the House to the people who not only brought us the so-called Great Recession, but who stood in the schoolhouse door and the door of the House of Representatives to keep us from getting health care passed again. After we see what we've had to go through to get the bill, after we see the bill coming down now with its benefits gradually available to people, we think more and more people will understand the historic breakthrough this bill represents for all of them, indeed individually, but it will take all of us to remind people that the enemy is still out there saying, we shouldn't have done this in the first place, we should have remained the only democracy in the world without health care. The only answer to that is to pay them back at the polls. Thank you for what you're doing today.